Hello friends. In hospital and clinical pharmacy, today we are going to deal with the new topic. Myself, Ms. Malvi Rajendra Bhavsar, KKR Institute of Pharmacy, Nashik. So today we are going to deal with new topic, new chapter, modern dispensing aspects. So after watching this video, student will be able to learn the concept of patient compliance, concept of patient non-compliance, reason for patient non-compliance, and role of pharmacist in patient counseling. Introduction. With the development of specific and potent synthetic drug, the emphasis of pharmacist's responsibility has moved substantially towards utilization of scientific knowledge in proper use of modern medicine and the protection of public against danger that are inherent in their use. For the various audiovisual and industrial reflexes are used, pharmacists play a very important role in counseling the patient. He utilizes his knowledge and clarifies the patient understanding about dosage regimen, method of administration, and advises him for drug-related precautions. So first, we are going to deal with patient compliances. Okay. Compliance or adherence can also be described as a patient extent to which patient takes the medication in accordance with prescription. Patient compliance can be defined as adherence to prescriber, instruction by the patient. Compliance can be calculated as percent compliance, NPD minus NME upon NPD into 100, where NPD is number of prescribed doses and NME is number of medication error. Patient non-compliance. It is a term referred to fault of the patient for inappropriate use of medication. It is not only restricted to drug therapy, but also includes failures to obey instruction on other aspects of healthcare such as dieting, exercise, and abstinence from the smoking or drinking. Then, reason for patient non-compliance. First reason is route of administration. If the route of administration is painful or patient find any difficulty in swallowing some dosage form, so non-compliance is generally observed. Then types of therapy. Chances of non-compliance are more in long-term therapy and in multi-drug therapy. Patient may forget to take medicine regularly or in time as prescribed. Forgetfulness. If the frequency of administration is more, patient generally shows non-compliances because of its forgetfulness. As many expensive medicines are not in the stock. Okay, because of forgetfulness. Then cost. As many expensive medicines are not in stock, various hospitals, some patients generally belonging to lower economic strata may not buy such medicine and show non-compliances. And it becomes important factor for non-compliances as large number of population in India is poor. Then poor instruction. Since patient is generally anxious of his health, his illness is therefore not in proper frame of mind to receive the information that is being imparted by the physician. Physician and pharmacist should use simple language or a compliance of therapy. Then side effect. As no drug is without side effects, patient may discontinue the treatment when nausea, vomiting, and GI upset, etc. is observed. Okay. So, this pie chart shows compliance, non-compliance. Lack of motivation from family and friend is 8%. Lack of proper counseling 28% chances. Poor compliance with treatment is 30% chances and non-affordability is 34%. Then consequences of patient non-compliances. First is underutilization of medicine. Generally, missing the dose or failure to get prescription filled result in underutilization of drug. It causes large number of therapeutic failures. Example, unawareness of physician, treatment of tuberculosis, missing dose, underutilization of anticonvulsant, missing dose of antihypertensive drug, or excessive pharmacological activity. Then overutilization of drug. Excessive dose may cause serious health hazard. Generally, they are administered more frequently to obtain quicker and greater relief and make the patient more prone to adverse drug reaction. And third, miscellaneous self-medication, improper technique of administration, and consuming outdated medicines. Role of pharmacists in improving patient compliance. Pharmacists have a major role in improving medication adherence in patient. They can confirm that patients are on the correct medication and are not taking any other treatments. Drug that may undetermine the effectiveness of important therapies. Then second, counseling. Counseling the patient concerning with the safe and appropriate utilization of medicines. So first, removal of drug from package. For the patient who is not aware of packaging, pharmacist must practically demonstrate its removal from the package so as to avoid any confusion. And how to administer. The patient should be advised about the route to follow so as to prevent the faulty administration of the drug. It should be mentioned clearly whether medicine is to be taken by mouth or used in ear or eye or meant for the rectal or vaginal insertion, or sublingual tablets are never to be swallowed. Then timing of administering a drug. The pharmacist must instruct the patient about administration timing. Since drug may cause GI upset, he may be required to be advised to take the drug with food, without food, or with milk or fruit juice or water. Non-compliance is generally observed while administering the number of medications. The patient should make chart medication so as to avoid forgetfulness, improve the compliances. Duration of uses. The pharmacist must emphasize the patient to take medication regularly for his major or minor illness. Whether the therapy is of short or a long duration, pharmacist must ensure that the patient follows the prescribed dose and usage regimen in order to derive the maximum therapeutic advantages. Storage of drug. Proper storage of drug is very essential for its safety and stability. They should be kept in proper covered cupboards and away from the reach of children. Allergies. Drug capable of causing allergies like penicillin, sulfonamide, etc. must be carefully detailed to patient. It reduces the incidence of drug-induced allergy. Medication history also plays an important role. Then side effect. Pharmacists must tell the patient about common side effects of medicines like constipation, headache, sedation, diarrhea, etc. Drug interaction. The pharmacist should warn the patient about possible interaction of prescribed drug like with food, beverages, and other drugs. Refill information. Pharmacist must inform the patient whether or not the prescription is to be filled or not. It all depends on the short or long-term therapy. It should be communicated properly so as to avoid patient non-compliance for the treatment. Additional information. It is given for the fulfillment of prescriber instruction by the patient for patient compliance. Short and simple sentences should be used to make the communication successful. For example, don't take tetracycline with milk or antacid, or shake the emulsion of suspension well before use. Additional and ancillary information. Communicate with patient. Use simple words, do not overload the patient. Give reason. These are the advice for the use of common drugs. Medication history. Objective of medication history is to develop the list of patient current and past record, determine if the patient has all allergies or adverse drug reaction with some drug, to know about patient self-prescribing habit and which over-the-counter drug he takes or prefer, to study the ability of patient to follow the prescribed medication and so the compliances. Thank you.